Caroline! I haven't seen you in ages. How are you?
I'm good, thank you. How are you? It's so good to
not
see
too
you.
bad.
Aren't you glad we've graduated?
Oh, so glad.
Yeah, seeing patients all day, every day is so rewarding.
Definitely
Yeah.
is. Yeah. Have you found a job yet?
Well, I was actually working at a private practice, but I recently just signed a contract to work in Yarrabah for 5 years.
Yarrabah. I wonder what that would be like.
Well, I'm not really sure, but I'll probably just play it by ear.
I think you should probably do some research. Don't you remember what Carolyn and Dr. Cruz taught us about?
You're right. I'll probably have a look now.
I'll have a look for you as well.
Okay, let's see here. So it says here that the Yarrabah community lies about 60 kilometers east of Cairns towards Gordonvale. It only takes about 45 minutes to travel by car from the Cairns CBD to Yarrabah. The coastline runs east from Falls Cape around Mission Bay, past Cape Grafton and Kings Point, and then south to Palmer Point. The total coastline is in excess of 60 kilometers. The township of Yarrabah is for the most part located adjacent to Mission Bay. Originally, European influence began in earnest with the establishment of an Anglican mission on this same location on the 17th of June, 1892. Over the years, subsequent state government administrations forcibly relocated Aboriginal and some South Sea Islander peoples from far and wide to Yarrabah. As a consequence, most local residents can claim both traditional and historical ties to the area. The first Aboriginal Council was established in the mid-1960s, principally as an advisory body. The community received its Deed of Grant in Trust, DOGIT, land tenure status in 1986, and is now self-governing under the Community Services Aborigines Act 1984. The community has an official population of 2,409 people as confirmed by the 2011 census. This figure is suspected of being less than accurate due to a degree of floating population between the communities and non-registration during times of census taking.
Oh look, I've just found some stats about the community from the ABS. So, like you said, Yarrabah has a population of 2,409, with 1,207 females and 1,202 males, so practically a 50-50 male to female gender ratio. The most significant age group is 5 to 14, with 527 people, about 22%, and then those aged 25 to 34 with 309 people, so about 13%. What? There's only 19 people aged 75 to 84, and 7 people that are older than 85. In terms of the Indigenous population, there are 2,254 people who identify as Aboriginal, 10 who identify as Torres Strait Islander, and 75 who identify as both. That totals 2,339 individuals, which is 97% of the entire population. And something that might be useful for you to know, their ASGCRA classification is an RA3, so they're an outer regional community. They've also got the largest Indigenous population in Australia.
Oh, all right, that's interesting. Does the website say anything else about the Indigenous tribes and the languages that they speak?
Yeah, it does actually. The main 2 tribes that live in Yarrabah are the Gurindji tribe and the Yidinji tribe. The main Indigenous language spoken is Yidinji. Oh, but some people also speak Creole or Yarri, and they learn English as their second language at school. But I think you've got some good information on the population of Yarrabah now.
I sure do. I still need to know more though, but thank you so much for your help. And also thank you for reminding me that I have to do some research about this population.
Yeah, no worries, Julian.
Awesome.
Actually, I have to go to my community engagement meeting now. I'm so sorry.
No, that's
but
okay.
let me know how everything goes.
Cool, thank you.
That's okay. Good luck.
Welcome to Yarrabah, Australia's largest Aboriginal community. We have many community events on this year, like a Babinda-based bus service, Paradise Bus, travels to Cairns via Edmonton and Gordonvale from Yarrabah 3 times a week, leaving from Yarrabah at 8:30am and returning from Cairns at 11am. This does not allow for residents from Yarrabah to travel into Cairns and home again on the same day if they have afternoon appointments or a full day of activities. It costs $13 to travel one way and takes approximately 1 hour and a half to reach Cairns City. Paradise Bus is also used as a charter service and for sporting events when required to commute to Cairns and the surrounding districts. Concerning travel within Yarrabah, the Gurini Yallamukka Health Centre provides patient courtesy transportation on a daily basis to allow for patients to access medical appointments within Yarrabah and Cairns. Currently in Yarrabah, construction is underway for a jetty with the hope of bringing additional tourism to the area. While over 50% of residents own passenger vehicles, marine transportation would allow for regular, easier and quicker access between Yarrabah and Cairns, as the current barriers to travel into Cairns includes costs of fuel and time spent away from families. There are limited employment opportunities for the residents of Yarrabah, and as a result, the community suffers high rates of unemployment. Interestingly, in 2007, the unemployment rate in Yarrabah was at a low of 3.2%. Now, in less than 10 years, of those who identify as being in the labour workforce, 61.6% are without any full-time, part-time or casual work. Only 23.1% of people living in Yarrabah have full-time employment. And of this 23%, 60% of persons are aged between 35 and 54 years, showing higher unemployment rates for younger residents. More so, 83% of the adult population in Yarrabah rely on income support payment from the Australian government. It's not surprising then that the median total income, excluding government pensions and allowances, in Yarrabah is $36,557, which is considerably less than the median Australian income of $44,940. The major industries surrounding Cairns and Yarrabah include fishing, agriculture and tourism. In Yarrabah, however, the majority of people are employed in public administration and safety. There are less Indigenous people participating in the community workforce than those of non-Indigenous descent. This may be due to a lack of access to further education and training for the Yarrabah residents. In 2011, the Australian Bureau of Statistics showed that only 37% of people in Yarrabah completed Year 12. 14% went on to attain an advanced diploma and certificate 3 or 4, and 2% achieved a bachelor degree or higher level of education. Again, these figures are less than the expected Queensland average. The Yarrabah community has one state school which extends from pre-prep to Year 10 and consists of 555 students, all of whom are of Indigenous descent. It has 3 separate campuses across the community, which also includes a special education unit to support the students with learning difficulties and disabilities. Gordon Vale is the closest high school where the majority of students complete Year 11 and 12. It also appears that Yarrabah community assists committed students in senior schooling opportunities outside the Cairns region. So visit Yarrabah today.
Well, that was a good video, but she didn't really talk about the health services. Oh, I'm getting a call.
Hi Julian, it's Dr. Melina Jablonski. I'm just calling you in regards to your new position here in the community, and I just wanted to see if you have any questions before you get here.
Hi, Dr. Jablonski. You just called at the right moment. I was going to ask you about the health services in Yarrabah. I researched a little bit about the community, but so far I'm a bit unsure what services are available and if they're run by the government or private organizations.
I understand that it can be a bit confusing when you first look at the community's services. Basically, all of Yarrabah's health services are joined under the one roof.
Oh, so even Queensland Health Services and others?
Yeah, that's right. For the past 2 years, Yarrabah is self-managed by the Yarrabah Aboriginal Shire Council. In fact, we are the first community in Queensland where the state government has transferred the responsibility of delivering health services, so primary healthcare, to an Aboriginal community organisation.
So Yarrabah has only one primary healthcare centre?
Not quite. So there is the Gurini Yarramaka Health Services, which was previously known as the St. Luke's Yarrabah Services, and they work closely together with the Cairns and Hinterland Hospital and Health Services, so basically Queensland Health, but we like to call it Gurini's. Then we have the Yarrabah 24/7 Emergency Department, which is operated by Queensland Health, and we have the ambulance services. So the ambulance services, they've got their own station here, and if needed, they can provide transportation to Cairns Hospital. And then the 24/7 Emergency Department is separate to Gurini's, and they actually provide services for accident and emergency care, childcare, radiography, women's health, and so on. But because they are operated by the Queensland Health part, there's a number of clinics also available through them. So I might send you the list actually. There are also some visiting specialists that come here on a regular basis, like you might have heard of the Australian Hearing Services or the Diabetic Outreach Team. And of course we've got Gurini's. That's our primary healthcare centre with doctors like me or the locum GPs registered nurses, Indigenous health workers, pharmacy assistant, and other health team members. And all services are bulk billed. Most people in Yarrabah have hypertension, hyperlipidemia, diabetes, or asthma.
Oh, the call dropped. I'll have to call her again. Sorry about that, Melina. So, by skimming through, I can't see any dental services. Are there any dentists in Yarrabah?
Yes, but limited. I know that Queensland Health provides free dental services to eligible patients. However, to my knowledge, there's no private dental clinic here. We work close with the Indigenous health services in Cairns, such as Wuchopran, and they run a dental clinic. Gurinis operates the school dental clinic twice a week, but those services come also from Queensland Health. So Dr. Lee is one of the visiting dentists, and he works in a private practice in Cairns, but he comes here and provides some services. Did you end up emailing him?
Yes, I contacted Dr. Lee, but he must be pretty busy. He didn't get back to me just yet.
Well, if you have a look online, not many patients are registered at the Queensland Health Dental Services list for Yarrabah here. I know our school dental clinic runs the child and prep dental programs. So with you coming here as our new local based dentist, have you thought of how you might want to engage with the community, or do you have any ideas or goals?
Not just yet, but I know I really want to make a difference to oral health.
Don't forget there are different types of need. You will have to identify the felt needs of the community and how they vary between the age groups. So currently we've got many programs in dental health working with the children in the community, and we had a great support through campaigns like Stop the Rot. One thing you need to keep in mind is that the people in Yarrabah and us as the health workers determine the health services we need. So Queensland Health provides us with guidance and assistance if needed, but we're pretty much self-organised through Gurinis. And so the needs of the family rather than the needs of the individual here show much greater success and better health outcomes for the community members. So by organising our health services this way, the locals and we as the health workers, we actually get a say in how the health services are delivered and, you know, how the services could be implemented in a much better suited way for the community. And so the community is quite proud of their health services, and there's great enthusiasm. I think we actually act as kind of a role model for other communities, certainly up in the Cape.
Well, from my experience, you certainly are.
I think the best person to consult with would be Nadia from the Yarrabah Aboriginal Shire Council. I sent you through her number.
Well, thank you so much for your time, Dr. Jablonski. I'll see you later.
No worries.
Hi, this is Nadia, CEO of Yarrabah Aboriginal Shire Council. How can I help you?
Hi, Nadia. I'm just working on my community engagement plan, and I was wondering if there were any important people that I should contact to help me engage the community.
Oh, alright. Well, first of all, you have to make sure that you are asking the right people the right questions. So you should engage with people across 3 levels: the community, the consumers, and the stakeholders and partners. Let me think. Well, first, you could speak with the tribe leaders, elders, and the traditional owners. They would have a really good knowledge of the community's culture and experience. And of course, there are the general community members themselves, since they represent the consumers of the oral health services.
Oh yeah, definitely.
Then you can talk to the local government. So there's the mayor of Yarrabah, a prominent community leader who can advocate for the community, and I believe his name is Errol Neal. There's also us, the Yarrabah Shire Council. We oversee any engagement projects done by other organizations. We're also involved in community engagement policies and procedures. It would also be good to talk to the Cairns Regional Council, as we work closely with them as well.
Right, of course. It's a good thing I called you then.
Yeah, we'll be able to give you information on how to contact your traditional owners, and they'll help you out in those regards as well. You can also work with us and decide what can and can't be feasibly done, and you can also contact rodeo organizers or sports teams through the council, and these people are well known in the community who can advocate oral health and be, I guess, role models. There's also the YASC program office who can help you get in touch with smaller community groups in Yarrabah, such as men's, women's groups, and youth groups. This way you can also reach these populations as well.
Yeah, well that makes sense.
Then there's those involved in the Queensland government. Queensland Health has implemented dental services in Yarrabah before, and have infrastructures for efficient services. They also have a well-known reputation and have their own budgets. The Queensland and Yarrabah Police Services would be able to consider the safety of the community in large community meetings. Oh, I'm getting another call. Can you hold?
Yeah, that's fine.
Hello?
Hey Nadia, I just wrote a new rap for our new community video. Listen, it's me, the way it should be, an Aborigine.
So sorry, Lindley. I'm kind of busy at the moment. I'll call you back. Sorry about that, Julian.
No, that's fine.
Right, so don't forget to contact Indigenous health workers and all those at Gurani Yilamaka Health Service, especially the medical and dental professionals. But it might also be worth your time to contact private dentists, Indigenous health workers, and the staff at the Multi-Purpose Health Service, because they'll be able to comment on how many people actually use their service, the main health issues in the community, whether or not a local dentist is required, all that. Maybe ask them the impact that their services have had on the community and whether or not there are any synergies or duplications of services which need to be addressed.
Oh yes, of course, yeah.
Maybe consider contacting various media outlets like the Yarrabah radio station, the newspaper, social media. They'll be able to help you spread the word about community meetings and help with engaging a wider audience.
Do you think I should also contact the principals and staff members of the primary and high schools? I think they'd be able to engage the parents and students in preventative oral health. And it's so important in improving the oral health of the community in the future. That way, they'll be able to help implement programs within schools.
Yes, exactly.
Also, the Yarrabah Aged Hostel, to engage with the elderly in the community, and Gindaja Rehab Center, to help us connect with patients who have drug and alcohol dependencies.
Oh, definitely.
This is all making sense. Thank you so much for your help, Nadia.
No, that's no problems at all. I'm happy to help. But do you have any other questions for me? I've got a meeting I need to run off to soon.
No, you're such a big help. I really appreciate it.
No problems at all. Good luck, Julian.
Bye.
Julian, how is everything going?
Good. So, after all my research, I'm going to develop a community engagement plan for Yarrabah.
Oh, well, you've called just the right person for that. I literally just got back from my community engagement meeting. Here's a great flowchart to get you started. I'll just send it through to you now. The first step in the process will be to clarify your objectives.
Yes, all done. I spoke about that with Dr. Jablonski. My priorities will be to ascertain Yarrabah's current dental health needs by involving all members of the community and engaging with them in an appropriate, culturally safe manner. This will include determining the felt and expressed needs of the community and comparing them to the normative and comparative needs established through my research.
Great work, Julian. It's so nice to see you taking on a preventative aspect of practice. I think it will really help you to maximise the effectiveness of your service delivery and hopefully help the community to develop better quality services in the future. Now you are ready to start identifying mechanisms for your engagement. In order to be effective, there are a few key values I will need you to keep in mind. Firstly, inclusiveness, to make sure all voices are heard. Secondly, reaching out, making sure that you engage with those hard to reach groups. Showing mutual respect, integrity, honesty and transparency. Affirm diversity, particularly considering language and culture. And thinking about how you will add value to the community. There are 3 different levels of community engagement: informing, consulting and collaborating. Each have their own advantages and disadvantages, but in order to get the best response from the community, I would encourage you to try strategies from each level. To introduce yourself to the people of Yarrabah and to give the community information to make informed decisions about their health, I suggest you try some informing techniques first. These tend to be more one-way communication, so it makes it difficult for people to ask questions or to clarify meaning. It doesn't build a two-way relationship, can be expensive, and is harder to evaluate, but it is much easier to reach a lot of people this way in a short amount of time, especially those in hard-to-reach places. Do you have any ideas for this sort of engagement, Julian?
Yes, actually. Yarrabah have their own radio station, so I might be able to put a message to inform people of how they can have their say on the dental health problems in their community. I have heard the advertisements for Cairns Regional Council feedback on the local radio at the moment, and it seems to be quite effective. I could also send out a message on the Yarrabah Aboriginal Shire Council Facebook page. However, this might be limited in the number of people it reaches due to the internet access issues. Other ideas might be to set up a community display at the Yarrabah Rodeo. This is a very popular annual event and may be an opportunity to engage the individuals who live at the outskirts of the community when they come together for the rodeo. I could also visit the schools in Yarrabah and deliver information sessions there. Overall, I see this as the first step, but I need to do more to get some real feedback from the members of the community.
Yeah, that's right, Julian. So the next level of engagement is consulting. This forms a two-way relationship wherein you are seeking views and ideas of services, policies and dental health and gaining an understanding of how community can influence decisions. This will improve your rapport, trust and respect within the community, as members will know their opinions are valued. However, it is essential to prevent feedback to the community, otherwise they may feel over-consulted with no clear outcomes.
I could do some qualitative research involving focus groups or workshops, focusing on what the dental health needs are in the community. Holding a community forum on dental health issues, including water fluoridation, may also be beneficial to find out their perceptions and opinions. These, however, may only be of those people who are confident enough to speak in front of larger groups, and may misrepresent the community as a whole. Other web engagement tools, such as a discussion forum on the Facebook page, may also be helpful.
I like your thinking, but let's take it one step further. The highest level of engagement is collaborating. This process will really enable individuals in the community to feel empowered to improve their dental health, as it instills a sense of ownership. The members of the community will become active participants in shaping the dental health needs and outcomes of Yarrabah. Any ideas here, Julian?
Well, when I was talking to Nadia, she mentioned that there are some well-established community groups, such as men's and women's groups, and the Yarrabah Shire Council. I will get in contact with them and see if I can establish a local community oral health working group. This will be advantageous, as people already in community groups may have a wider understanding of the health needs, as well as be motivated to make a difference. A roundtable discussion with a number of my stakeholders would also be extremely helpful, as it encourages open discussion about issues and may result in change happening sooner if significant decision makers are present. This may require numerous resources and funds, and it may be difficult to get the community members together at the same time. I would have to be extremely organized when planning meetings like these.
Yes, Julian. Unfortunately, these things take time. Be patient, but keep your ultimate goal collaboration amongst the community. I'm assuming you'll be living in Yarrabah?
Yeah, I've signed a 5-year contract.
Well, perfect. You will really be able to immerse yourself within the community. Now, remember that Yarrabah has a significant Indigenous population. How are we going to go about engaging and practicing in a culturally safe way?
I will use the skills gained in my undergraduate studies and throughout my various rural placements to act in a culturally safe manner. I will be considerate of the needs of the community and within my practice, accommodate as best I can for any cultural needs, for example, a female requesting a female practitioner. However, before I practice, I will need to consult with the mayor of the town and the tribe leaders. To do this, I may require a linking person, such as a current medical practitioner who is already established and respected within the community.
How about the very small population of elderly people? Are you going to do anything different to access this population?
So, another technique to consult the elderly people, and also those hard-to-reach members of the community, such as stay-at-home parents or those in rehab centers, may be to conduct a citizens panel or a community survey. These may be in the form of a paper sent in the post or an electronic survey. Another option is a telephone hotline, so people can call and have their message recorded when it suits them.
Finally, it will be important to continually evaluate and review your progress, so you will need to make plans early of how you wish to evaluate your community engagement plan. You may then want to feedback the findings to the community. How might you go about doing this?
Well, I guess my ongoing evaluation will depend on what I decide to do, but overall, I think the most useful feedback tool will be short surveys. These may be printed or handed out following various interventions, such as community meetings or forums, at the community stalls, and after roundtable discussions and focus groups. These will require people to rate how useful they found the sessions, and their expectations of how soon they would like to see change. I will then need to produce weekly or monthly reports to present to the local council and community members, with feedback on how the engagement is proceeding. This may be in the form of a short-spoken presentation to council, or in a printed pamphlet for community members.
Yes, Julian, I think you're on the right track there. I hope I've given you some pointers today.
Yes, thank you so much, Sophie. You must have done this before. I can't wait to head out to Yarrabah now.
Good luck, Julian, and remember, most importantly, have fun!
I will. Bye!